So quickly, let's share some essential tips that will help maintain our kidney, not just our kidney, but for our overall health. But to a large extent, it will prevent kidney related diseases. Let's also remember that the kidney plays a vital role in filtering waste products and excess fluids from the body, regulating blood pressure, and producing essential hormones. By adopting few healthy habits, you can help promote kidney health and reduce the risk of kidney problems. So let's look at the tips. Number one, stay hydrated. Most times we are dehydrated, but adequate hydration is essential for optimal kidney function. Water helps us a lot. Water helps the body. Water helps in flushing out toxins and waste products from the kidneys. Aim at least drinking 8 cups of water. Okay, sometimes we say 8 cups. Most times we don't even get to drink 8 cups. But at least drink 6, 5. You can maintain these routines every day. You are helping your kidney. So drink water a lot unless you're advised by your healthcare otherwise not to take water. However, keep in mind that individual water needs may vary based on factors like climate, physical activity, and overall health conditions. So the second factor we'll be looking at, or the second tips, will be maintaining a balanced diet. Most times we all are not able to access the healthy balanced meal, but at least the vegetables around us, natural herbs that God has created, let us try to infuse them in the foods we cook and eat. Eating a healthy, well-balanced diet is crucial for our kidney health. Let's try to include varieties of fruits, vegetables, whole grains, lean proteins, healthy fats. I emphasize on healthy fats. Let's limit the intake of processed food. Before you know it, don't jump enter what's that place. You've entered the Chicken Republic, you've entered the food pot, you are here and there taking processed food that have high sodium foods, saturated and trans fats. Even is it sugary beverages? Let's not talk about that one. Please, let's watch on these things. Sometimes take time to cook. Normalize cooking what you put in your system. Additionally, watch your portion sizes to maintain a healthy weight. You know this trend where they are calling you foodie, you're a foodie. See obesity. Watch your portion sizes to maintain a healthy weight, as obesity can increase the risk of kidney problems. The third thing we'll be looking at is controlling blood pressure and diabetes. High blood pressure and diabetes are leading causes of kidney diseases these days. Regularly monitor your blood pressure and blood sugar levels and take steps to keep them within a healthy range. Consult your healthcare provider for recommendations or lifestyle modification medications that will help you. Then follow on with your regular checkups. Then number 4, exercise regularly. Most times, most people put up a picture, they go to the gym, but that's just performance. Most times, it's just to see that sight of them being in the gym. Most times, they don't even engage in the regular physical activity. But today, I'm encouraging you to engage in a physical activity. You mustn't be going to gym. If you mustn't afford those physical trainers or put a lot of finances together. You can take a long walk, climb staircases. There are other anaerobics, or depending, is it aerobics or anaerobics again. So engage in regular physical activities. It helps you. You can walk sometimes. You can just take a walk. You can jog, because exercise helps maintain our healthy blood pressure. It helps manages our weight. It helps our cardiovascular fitness. At least sometimes, even if it's 25 minutes, 30 minutes, like moderate intensity. Yeah, I think it's moderate intensity aerobic exercise. Sometimes, then as you are increasing, you can now maybe put up a more level that you can handle. As you increase, you can do vigorous ones. It's not as a beginner you go and join and start doing vigorous physical exercise. It is going to either weaken your muscles or cause strains. So along with a healthy along with a healthy physical exercise, please avoid smoking, limit alcohol consumption. Sometimes you just stay with your friends, you want to feel among, you want to show up, you want them, so they will not say you don't belong or one thing or one thing. You are just trying to, who do you want to impress? Who on earth? Let me tell you, if something happens to you, just in a second the world will move on. Even that your best, everybody will move on. Please, smoking damages blood vessels and reduces blood flow to the kidney. Quit smoking. That's one of the best things you can do for your kidney. Additionally, excessive alcohol consumption. Sometimes you see people, they just carry bottles of beer, they'll be consuming rubbish. Alcohol consumption can lead to kidney damage and negative impact, not just on the kidney but overall health. If you choose to drink alcohol, that is, if you choose to do so in moderation, don't drink to impress anybody. Then the sixth or fifth on the list should be practice proper medication use. In fact, this one, I'm more intentional on this. You see small thing, malaria, you don't rush go pharmacy, go buy one what's those malaria drugs. You've bought I can't remember some malaria, but you bought one malaria drug because you felt the last time you took it you were well. Then you will not consult your medical practitioner. You just go and buy a drug and take. No moderation, no prescription from a doctor. That's very wrong. Sometimes you might even take high doses, or you extend periods of taking this drug, and this can be harmful, very, very harmful to the kidney. Non-prescription pain relievers like all these NSAID drugs we take, ibuprofen and the likes, some antibiotics, they are very harmful. Always ensure that when you are taking medications, there should be proper prescription by your healthcare provider. Not because paracetamol can help alleviate the headache. You now rush and sometimes you take six times in a day. That's drug abuse and it's harmful to your kidney. Then I think the seventh one, most times, sometimes too, we can actually ensure all these measures and still end up having these things. But let us be intentional and do our part. Then God, whom is your greatest healer, will take care of us. Lastly, I want us to take care of our regular health. Do checkups, routine health. It mustn't be when you are down with malaria, typhoid, or one thing. You will not be doing this you will not be doing fire brigade approach. No. Our advice, routine health checkups. Regularly monitor your kidney function. Get blood and urine tests by your healthcare provider. Don't just go to a trusted and recommended healthcare provider. Then if you have existing medical conditions, maybe in your family there is history of kidney disease, discuss with your doctor, talk about these things. Don't just relax. So by implementing these essential tips I have given, our kidney will be good and it will promote overall health, not just for our kidney but for our body too. So remember, prevention is the key, and maintaining a healthy lifestyle goes a long way in reducing the risk of kidney disease. If you have any concerns, if you have something you must know,